Hello, and thank you for joining us for this training session. Today we're looking at the GoLift ceiling hoist. The GoLift ceiling hoist provides a motorised lifting solution for those with physical disabilities. The ceiling hoist removes risk for those persons and their care assistants. The GoLift is available in two different models, the GoLift 400 and the GoLift 700. The model number is identified on the case of the hoist on the label at the end of the box. The GoLift 400 has a safe working load of 28 stones. The GoLift 700 has a safe working load of 50 stones. The track system in your room should have a label stating the safe working load at which it is safe to operate the hoist. A GoLift hoist is mounted to a track system fitted near the ceiling in your room and provides an easy way to roll the hoist and the patient either along a straight track or across an H-frame system, providing access to different parts of the room. The GoLift hoist is described largely as a two-way hoist. This means it has powered lift and powered lower, but the side-to-side function and motion is manual and provided by the care assistant. The GoLift hoist has two charging methods, either with an in-rail charging system or via a handset. The GoLift hoist has internal batteries which provide it with enough energy to perform up to 40 lifts. These batteries also provide the necessary power in the case of a mains power failure. The hoist is operated via the handset. The handset is located at the end of the curly white cable, and the handset is equipped with a magnet which helps it store itself on the spreader bar. There is two buttons on the handset, clearly marked for up and down, lift and lower. By touching the buttons, the hoist will operate, firstly with an audible signal to identify it's about to move. At the top of the handset is a LED light panel which also provides a status of the hoist. If the light is green, this gives you the information that all is well with the hoist, it's in good working order. A yellow light indicates the hoist is charging and should be shown momentarily when the hoist starts to charge itself. The hoist will turn itself off after around 30 seconds of inactivity, preserving battery life. The third light on the handset could be red. Red signifies an issue. If the red light shows on your handset, it could be that there is a serious fault and this should be investigated. The spreader bar is the part where the patient's slings are attached. It is possible that in your location you don't have any slings to hand. It could be that your policy encourages users to bring their own slings, and this is often the safest way. The sling should be of a loop style, not a clip style, and the fabric loops are connected to the spreader bar through these flexible joints at the end of the hooks. The spreader bar rotates through 360 degrees, minimizing tape twist and providing an easy way to position the patient on their equipment. The GoLift is equipped with a red emergency strap. Pulling this strap will operate the emergency stop function. Once this has been pulled, in order to restart the hoist, the button at the top of the red cord should be pushed back into the unit. This can be done by hand, or if the hoist is too far away, use the spreader bar to push this back inside the hoist. It should only need a small amount of effort to move the button. Pulling and holding the red strap on the hoist will operate the emergency descent function. Firstly, there is an audible signal and a short pause, and then the hoist spreader bar will descend automatically through its entire range or until you release the strap. As before, having operated the hoist in this way, you will need to reset the hoist by pushing the button at the top of the red cord back into the unit. The GoLift patient hoist is governed by the Lola regulations of 1998, and thus it should be subject to a strict and regular maintenance schedule. The Lola regulations state that a hoist of this type should be tested every 6 months. Please ensure that your hoist has this service and maintenance contract in place, otherwise it could invalidate the warranty. The purpose of this training is to equip you with basic knowledge of how to operate the hoist so you can guide your guests in how to use it. Ensure that if you are to perform manual handling tasks with this hoist, that you do have up-to-date and comprehensive training. An instruction manual will have been left with your facilities management team, which will give full details on how to operate and troubleshoot the hoist.